I chose the Vinci prostatectomy because after the research I did, after I was diagnosed with prostate cancer, but the various alternatives that I had for treatment, that first off, I wanted a treatment that would basically eliminate the cancer. I wanted the cancer gone. And most importantly, also to me, another thing that was highly important was the after effects of any type of prostate treatment, whether it be radiation or surgery. And the research I did on the Da Vinci procedure was that it offered the most exact, technically exact procedure that they can have, where they can get close to the nerves and get the diseased tissue out without causing permanent damage to me in other areas. And I not settled on, but I chose, and I was happy that the Da Vinci prostatectomy procedures were available to me. I chose surgery over radiation. Once I was diagnosed with cancer, I started speaking to other people that I know that had it. And I spoke to quite a few people that I had worked with over the years and know almost my whole professional career. And I've spoken to people who had seeds and radiation. And one thing that was common in both methods was that there was a tremendous amount of fatigue. And I'm a very active person. I'm a runner. I'm engaged in sports. I like to stay fit. And the people that had the radiation were very fatigued for months. The other effect that I was told from my urologist was that radiation could have other side effects that could be more pronounced down the road, and I chose not to take that risk and go with something that I thought would be a minimally invasive type of surgery, and that's why I chose the robotic procedure. When I went for the surgery, I was operating on about 7:30 in the morning. I woke up at 11 o'clock, and I probably woke up a little before that, but I was conscious at 11 o'clock in the recovery room. And I really felt no pain or discomfort. They didn't even need a painkiller. They just gave me Tylenol. And stayed overnight in the hospital. I was up and walking around with a nurse standing next to me maybe 2 hours after I went to my room. But by 1 o'clock in the afternoon, I was walking the halls of the hospital. And the next day I was discharged from the hospital. I had a catheter that was removed after 5 days. And I was basically back to walking within a week, a mile, 2 miles. And I couldn't ask for a better outcome. I was back to being as active as I wanted to be. I didn't want to push things, obviously. I was told not to run because it is a surgery. But I was pretty back to normal. Within 2 weeks, I was back to work. Well, I'd like to say to men that are diagnosed with prostate cancer, I know how you feel. You probably feel like someone punched you in the stomach. It's a real blow. But gather yourself, do your research. You realize that if there's a cancer to get, this is the cancer that you can get. If it's detected early, that you'll probably be cancer-free for the rest of your life. As far as what to look forward to, as far as incontinence and sexual function, that's not going to be that much affected. In fact, I had no effect after 8 weeks. And versus other methods that you have, I can't speak on how that would be with the other methods, but I can say that as far as your mental attitude, look at it, fight it. And my advice is, if you've got a cancer, and if it's the kind of cancer that they can take out and throw it out, let them do that rather than treat it and keep it in.